Hey everybody. So one of the things that I'm a huge believer in is this idea of setting up the microenvironment, your internal microenvironment, so that way you can have a better response to any of the therapies that we're going to do for your pain, whether that's an actual regenerative injection therapy or some other type of physical intervention. Now, a lot of the patients that we're working with, it's not like they're walking in with vitamin C deficiency that causes scurvy or, vitamin D deficiency that causes rickets. It's not that extreme of deficiencies, but that doesn't mean that patients can't be in a subclinical status of a particular nutrient. Right? Some of the bigger things that we commonly see patients deficient in are magnesium, vitamin B6, vitamin C, vitamin A, and vitamin D, and glutathione. Those are kind of the big things that and zinc. I can't forget about zinc. A lot of patients come in with subclinical deficiencies of those nutrients. And so a lot of those nutrients are actually involved in how our body is going to heal something, whether we're going through a new injury, whether that's an actual injection or an injury, or resolving from a chronic inflammatory condition or degenerative condition. And so one of the things that we really focus on is taking a good history, doing the appropriate lab work, trying to figure out and approximate what micronutrients might patients be deficient in, so that way we can augment their healing with those nutrients. And so we can do vitamin C, magnesium, B6, zinc, all these different vitamins and minerals beforehand to kind of top up internal cellular stores of these nutrients, so that when we come in with a PRP injection, for example, these cells are better able, they have better substrates to actually be able to go through these processes. So an example to walk you through is vitamin C is a cofactor that is involved in the production of collagen. And so if you are subclinically deficient in vitamin C, then the enzyme machinery that actually is going to turn everything we need, all the amino acid precursors into collagen, will not run as quickly or as efficiently. And so we can top up stores of vitamin C so that way collagen can be made more efficiently, can be made quicker, and we don't kind of tap out our storage. The other thing too is that even if you're not at a subclinical deficiency and you're maintaining adequate nutrient status, during a time when we need a healing response to happen and we're going to have increased production of collagen, your body's going to burn through the cofactors and coenzymes that are used during that procedure or that process. And so during the time of healing, vitamin C and zinc and selenium are at higher need because the enzymes that are used to actually go through that healing process have been upregulated to actually help with that healing process and to heal you. And so there can be benefits to supplementing in that scenario. And so not everybody needs this type of optimization. We have some high level athletes that we work with that, they're not really in a place where they are clinically or subclinically deficient in these nutrients. But what we do see is that a large majority of patients do come in and they have anywhere from 2 to probably 8 or 9 different subclinical deficiencies of micronutrients that we really want to work on beforehand, so that way we can maximize what we're getting out of procedure. Because at the end of the day, this is what I want. I want to help people to improve their health overall. So if we start doing some of these nutrients, remember, vitamin C, selenium, zinc, B6, all those things are not just used in the healing process, they're used all throughout the body to perform basic biological processes. So I want to help improve the health of a human while maximizing what we get out of a procedure. So if we can get a patient an extra 10 to 30% improvement out of a procedure because we use different supplements, herbs, and nutritional approaches, then I'm insanely happy because it saves money on the back end for patients. And again, I said, it makes patients and people healthier in the process. So that's just how I think kind of through these things with patients and talk with them about making them healthier on the inside first before we come in with a big gun procedure like that. If you guys have any questions, hit me up in the comments below, and I'll see you later.